That is definitely one thing to consider because vitamin D is a fat-soluble vitamin. So for those people that do not have a gallbladder, they're more prone to vitamin deficiency. Um, so other things to consider. So I'll just kind of jump into what I have here, Jamie, if you don't mind,
Sure.
and then
Yeah, go ahead.
anybody, any of the other practitioners want to jump in, that's great too. But you think about what could prevent vitamin D absorption. And so leaky gut. So if you've in right now, obviously we're in a group setting, so you can share the details or not, but I won't put you on the spot. But if something resonates, then I want you to speak to your practitioner. Okay. Because what could be preventing absorption are the things that you need to consider. Okay. So leaky gut, gallbladder, as I mentioned, that's not you because that's not a variable you have to consider. But there are people here listening that don't have that. So then that's another consideration. Fat soluble. So one thing that can help with absorption of it is to take it with a fat. So if you're taking your oils, that's a great time to take your vitamin D because that's going to help the uptake of your actual vitamin D levels. Other things worth mentioning because you're here, toxins, right? So what can prevent the absorption of it? So when you look and consider the cell, just to kind of recap why you're here, like if this is the cell, we've got cellular inflammation. Okay, my other hand represents cellular inflammation. That's going to block the good vitamins, vitamin D, right? Is considered there good vitamins, other vitamins, nutrients, and minerals. In addition, the hormones. Okay. So it blocks the good stuff, the vitamins, the nutrients, minerals, and hormones from getting into the cell, and it prevents the toxins from getting out. Yeah.
Yeah.
So this is what I want you to wrap your mind around. It's early, okay, for you in this. So this has been going on for quite some time, it sounds like. Yeah. So it's
Yeah.
early in this. So this is the process that's going to take place is by doing what you're doing. We're minimizing variables that we have to consider, laying a foundation and eliminating the trying to melt away essentially in the early phases. We're preparing and prepping. And we're also trying to melt away and eliminate anything that could cause any additional inflammation. And this is we're considering hidden inflammation. So some people come and they're like, but my CRP levels and my blood work is normal, but they don't feel good and their blood work is normal, right? To bring it back, I want you to consider this is if this is there, which it is, if you have any unwanted, undesirable symptoms, okay, then we're going to melt this away, chip at it in phase one, phase two, open up those key detoxifying pathways, your liver, your kidney, your lymph, and your GI system. And then we're going to eliminate more efficiently the toxins that have accumulated over the years that are stuck inside the cell at this point. So
Okay.
that is definitely a consideration. Okay, so we've got leaky gut, we've got, for those of you struggling with gallbladder and or have had that removed, that's a consideration. Alyssa, again, worth repeating, not you, because that's not a variable you're considering at this point. And then the toxicity and the malabsorption. What are the two key things that we're addressing as you go through this process? Practitioners, what do you got? Malabsorption issue, right? And toxicity. So I would say that's definitely a consideration as well. Okay. There are other like nutrients that you could consider in terms of micronutrients, but I won't necessarily go into that. Um, One thing that I also would consider is your stomach acid. That will and should improve as you go throughout this process. So again, you're in the right place. Okay. But it is going to take time. So just consider those things. And then what could be causing the malabsorption, okay? And then what to do to maximize absorption. Simply take it with a fat. And then
Okay.
also consider increasing the dosage because sometimes people look at 2 to 5,000, they're like, ooh, I don't know if I should take this much, when really the toxicity level of vitamin D is quite high. So you can even go up, a conservative elevation for me would be like a 10,000 international units or IUs for the next 3 to 4 weeks. Okay. Then pare down to 5 and then go to 2 after testing. But I wouldn't decrease from 5 until you test again.